Okay, well, let's talk about how would you even know that you have a heart issue. As we talked about earlier, heart disease is considered the silent killer. Heart attacks happen. Many people don't know that there's something wrong with their heart. The first symptom of heart disease can be a heart attack and death. And unfortunately, if death is your first symptom, not a lot you're going to be able to do to solve that problem. And so we want to figure out what could be done before you have a heart attack to find out if you have heart health issues. And really the best ways to determine that is to go and get these routine tests. And so I think a lot of us are familiar with going to the doctor, and we're told to get our cholesterol checked, we're told that getting your blood pressure checked, having your heart listened to, that these are all really good things to help to determine if you're dealing with heart disease. And I would agree that these things are things, blood markers that should be checked for, blood pressure should be checked. And so we're going to talk about each one of those. And when it comes to cholesterol, I'm actually going to get into great detail about that. So let's talk about a few of the other things first. Getting your blood pressure checked is a good thing. We can get it checked. We can go, stop at CVS Pharmacy. We can go to Walgreens, and they have this machine, put our arm in. Not the ideal place to be getting your blood pressure checked. If you're going there consistently, at least you can see on a consistent basis if something's changing. But I would definitely recommend going to someone that's trained in what they're doing. And one of the things that we do in our office that I think is really important is that when you get your blood pressure checked, you should be getting both arms checked, not just one. We had a patient in our office a few years ago that the reason she started coming to our office, very fatigued. She had all these different symptoms, but the biggest one was that she was just tired all the time. And so we get talking to her, and she was on blood pressure medication. They were looking to lower her blood pressure, and the reason why is because they said every time they check it, it's high, and even with the blood pressure medication, they're still seeing that it's high. So what we did was we took her blood pressure and we took it on both arms. We do it together because we want to, at the same time, I should say. And the reason why we do that is there's a neurological thing that we're looking for. If one side blood pressure is different than the other, that can tell us some brain health issues. But what we found when we took her blood pressure is that one side, I think it was the right side, was very high, but the left side was actually really low. And so we started investigating, like, why would that be? Did she have a neurologic reason for that difference? And we couldn't see one. And so what we did was we sent her back to her doctor, and then the doctor did more investigating, and what they found was that she actually had a tumor in her, in kind of this axillary part of her body, in that shoulder region. And what it was doing is putting pressure on that blood vessel, and it was causing that blood vessel to have to pump really hard, and the blood pressure was going up significantly. So she really didn't have a systemic blood pressure issue. What she had was an issue that was causing the blood pressure to rise just on that one side. So she really didn't need to be on blood pressure medication. What she needed to deal with was this tumor that she was dealing with in her shoulder. And so that's why it's so important if you are going to the doctor to get both sides of your both arms checked, because there can be a difference. And like I said, there's a neurologic component to it too, so it could tell you some more about your brain if we're seeing a difference from side to side. So really important to get your blood pressure checked. We mentioned that 46%, that's 1 out of every 2 adult American, is dealing with hypertension. And again, hypertension, that's that having your blood pressure 140/90 or higher. And so we look at a large number of people are dealing with high blood pressure. So good to get your blood pressure checked. Other things that we look at when we look at someone's blood labs, which we think are very important, and research shows that these are tests that are very predictive of whether someone's going to have heart disease or not. One of them being a test called homocysteine, which is an amino acid that we have in our body. But the problem with this amino acid is if it gets too high, and when we look at blood markers, we start looking at anything over 7 being too high. We get into that 10 range, get into that 14 range. Now we're really sitting at a place where it's too high. Homocysteine, I've heard the analogy used that it's almost like little ninja knives that are in your blood vessels, and they're causing damage. They're poking holes in the blood vessels, which is a bad thing. And so if your homocysteine is high, that can be an indication that you're going to create inflammation in the blood vessels because of the damage, and then what you're going to try to do is repair that inflammation, and then what's going to happen is you're going to start to create like hardening of the arteries. You're going to create plaques because you're laying down a bunch of scar tissue to heal that blood vessel. So homocysteine is a really good test to get measured. Another one that can help us to determine if someone's got high inflammation in their body is to look at their CRP, or their high sensitivity CRP. And so when we look at that, it doesn't point us specifically to a person having inflammation in their blood vessels, but it does tell us if systemically there's inflammation, and if there is, that's always a bad thing. So CRP is another test that you should get measured, or C-reactive protein is what that stands for. Blood sugar. Having your blood sugar tested, looking to see if a person is either pre-diabetic or diabetic, is really important, because if you are diabetic, you're twice as likely to develop heart disease as someone that doesn't. So really important. If you have high blood sugar, it does set you up for a path of having heart disease as well. So getting someone's blood sugar tested is important, but we like to do a full panel, and what that full panel is looking at is blood sugar, hemoglobin A1C. Looking at insulin levels can be a really important thing, which I don't understand why many doctors don't do this, especially if they're thinking someone might be dealing with pre-diabetes. You need to look at their insulin levels, and there's two ways to look at it. One is to look at your insulin, and another is to look at C-peptide, which is actually a better marker of what's your insulin been doing over the course of time. It's kind of like hemoglobin A1C. If you don't know, hemoglobin A1C is looking at your blood sugar over the course of about 120 days. Really what it's looking at is how is sugar, what's sugar doing to damage your hemoglobin. And so what hemoglobin A1C looks for is what's your blood sugar been like for the last 120 days. That's the same as C-peptide. It's looking at, well, how's your insulin looking over the last period of time, versus if you just get insulin, that's looking at what's your insulin like right now. And so when you get a blood sugar panel, and if there's any indications that there's blood sugar issues, highly recommend that you find out what your insulin levels or your C-peptide is. A friend of mine dealing with borderline high blood sugar, sitting at 101, hemoglobin A1C sitting at about 5.5, 5.6. Anything over 5.6 is bad. Blood sugar, anything over 100 can be indications of poor blood sugar control. And so he was sitting at the very top, okay, but the doctor's saying, well, you have these blood sugar issues, but really not bad. We're not going to do anything about it. And what I encouraged him to do, I said, you need to go and get your insulin levels checked. At first the doctor's like, well, we're not going to test your insulin. That doesn't make any sense. We're not going to see any problems with your insulin. But he pushed for his doctor to do a full panel that also measured the insulin and the C-peptide, and sure enough, his levels were high. And so a lot of times those numbers, insulin and C-peptide, will go up way before someone's blood sugar, because it's more what we call hyperinsulinemia. And what's happening there is the insulin's so high, but it's still keeping the blood sugar at a point where it looks normal. So a better indicator. So blood sugar, really important to get checked when it comes to heart disease.